So today we're reporting on the 3 periods over this past weekend. Between Friday and Saturday, we had 835 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 671 new cases. And in the last 24 hours, an additional 668 people were diagnosed with COVID-19. So that's a total of 2,174 new people diagnosed over the weekend, bringing our total in British Columbia to 131,656 people in our province who have had COVID-19. That includes, over the weekend, 438 people who live in the Vancouver Coastal Health Region, 1,509 people in the Fraser Health Region, 61 people in the Vancouver Island Region, 106 people in the Interior Health Region, and 60 people who live in the Northern Health Region. We currently have 7,327 active cases around the province, of whom 474 are in hospital, 176 people in ICU or critical care. We have an additional 11,781 people who are under active monitoring and 122,518 who have recovered from COVID-19. The 2 outbreaks that we've had at the Prince Rupert Regional Hospital and at Abbotsford Regional Hospital have now been declared over, and we have 1 new outbreak at Lionsgate Hospital. That leaves us with 8 active outbreaks in long-term care, assisted living or independent living, and 3 in acute care. Over this past weekend, we've had 15 more people in British Columbia who've died from COVID-19, bringing the total number of people in BC to 1,596. As always, our condolences and our thoughts are with the families who've lost a loved one over this past weekend, with their care teams in the communities. We know how challenging it is to mourn somebody during these continuing difficult times. Just to put that in a little bit of perspective, the majority of the people, everybody who passed away over the weekend was over the age of 70, with the exception of 1 person who was in their 50s. And most of these deaths occurred in hospitals. As you know, the focus of our vaccine program continues to be to protect as many people as possible, as quickly as possible, to reduce the risk of transmission and the risk of hospitalizations across the province. In addition, we're addressing hotspots and reducing overall transmission. To date, we've delivered 1,877,330 doses of all 3 of the COVID-19 vaccines that are available here in British Columbia. Of those, 91,731 are second doses. Everybody in BC now who's 18 years of age and older is eligible and should be registering on our Get Vaccinated website, or by calling 1-833-838-2323. This is the simplest and most effective way to get your dose of vaccine as soon as possible. Registration is required only once, and I know some people have had some concerns about whether when they receive their vaccine through a workplace program or through a pharmacy program for the AstraZeneca vaccine, do they need to register? And yes, it is helpful to register again, just the once, but if you do register more than once, the system will recognize that as well. Once you are registered, your dose will be reserved for you as soon as the program becomes available, and you'll be notified when to book. This is the most efficient way that we can do this, and appointments, as you know, are now being booked for people, everyone age 54 years of age and older. So if you're older than 54 and you've not yet received a notification to book, make sure you check on whether you've been registered and go online. If you register right away, you will be able to book right away. With more vaccines arriving this week, these appointments will also be speeding up. The most efficient way to get your vaccine, and right now in our age-based program, the basis of our program is the Pfizer and Moderna vaccines that we're receiving in greater and greater quantities in these next few weeks. So register now is important. We have reached a new and encouraging point in this vaccine supply. Starting today, the vaccine that we will be receiving will be increasing significantly. In the month of May alone, we'll be receiving over 1 million doses of vaccine available for people across the province. This is good news for all of us. It means that everybody who is eligible, so right now that's down to age 16, will have access to a vaccine before Canada Day, and we think significantly before that. And that leads us to think about the interval we have between the dose 1 and the dose 2. As you know, the most important thing that we know will help stop transmission and protect everybody is to get as many people as possible their first dose of these vaccines as soon as we can. And with the new increased supply that we have, we are looking at the potential of decreasing the interval to less than 16 weeks for most people. Right now, those people who receive their vaccines early on in the program are getting notified about their second dose, and we've been doing that and will continue to do that as more people get up to that 3 to 4 month mark in the next month. But as we open up immunization to all adults and we get everybody with their first dose, will be able to speed up dose 2 as well. And we're looking at how we can do that in the coming months and weeks ahead. We're moving as quickly as we can to get vaccine into arms and to keep this in step with the supply that we have. The clinics that we've set up are ramping up this week to be able to deliver the vaccines that we expect to receive. But we know that there's been glitches along the way, particularly with our IT system that we've been developing to make sure that we've recorded every dose that everybody has, both for safety reasons and also for your permanent record. In some ways, we've been building a spaceship as we've been flying it, and we're now entering into a new era, a new warp speed, if you will, and there's bound to be bumps along the way. But we will adjust. We know that over the weekend there were some concerns about people registering who'd already received a single dose, and we're getting messages about registering again for their first dose. We will take care of those glitches. There's bound to be more that will arise as well as we're getting more and more vaccines and another 1 million doses into people over these next few weeks. But everybody will get their vaccine and will get their turn, and that turn now is coming soon. I know as well there's some concern about people who've received AstraZeneca and whether there will be second doses of AstraZeneca available for people. We are hearing that yes, Canada is looking to make sure that we have the supply we need. And we are also watching very carefully what we call the mix and match studies that are going on around the world, particularly in the UK, and we will have more information about that. It may turn out that it is a better, stronger immune response to receive a second dose with a different vaccine. We don't yet know that, but it could be that we'll be able to provide the mRNA vaccines like Pfizer or Moderna as a second dose for people who've received AstraZeneca, or vice versa. So those are the things that we will continue to follow, and when we get that information, we'll provide it to you. So we know that the vaccine is coming in increasing amounts. And when we think about our pandemic and what we are going through right now, what we're seeing is decreasing, slowly but surely, decreasing case rates in our communities. And when we think about how transmission occurs, it's like a path with many, many forks in the road. In some cases, it's one person that transmits to one other person, and that goes on. But in some cases, we know with this virus that it can be a situation where one person transmits to many others. And we know there's certain situations, certain environmental conditions that make that more likely. what we call super spreader events, when one person can affect many people. And that's the way that this virus tends to spread. And that's why we've been focusing so much on reducing those situations where that can occur. That means keeping your numbers small, being outside rather than inside, making sure you're wearing masks and keeping distance when you're inside in particular. We've been on a very steep upward trajectory in our case curve over the last few weeks, and our hospitalizations remain high. And as we know, there are many people right now in critical care and ICU. But there also are some encouraging signs that our efforts are working, that we're starting to come down on the other side of the curve. And as we've seen in places like the UK, the US, once we get down that curve, we can start to see dramatic decreases and more people in our communities protected and preventing transmission. But we need to keep doing the measures that we know worked to prevent us from transmitting to everybody else. What we need to keep doing, it's up to all of us to take those measures to stop the spread. And that means staying local, keeping small, staying away and getting tested if you have any symptoms at all, and getting vaccinated when your turn comes up. And I will also say, reach out to your neighbors, your friends, those you know, to help them get vaccinated as well. We know in some people it's still a very complicated process, and we can all help each other get that process, make it simpler. It's going to be a while before we no longer see new cases, but we need to keep doing our bit to stop those chains of transmission and stop the chance that it's going to spread to large numbers of people. And the things that we are doing are making a difference, and we need to hold the line and keep doing them for the next few weeks. We don't want another upward climb, and we know that that can happen if we take our eye off the end game too soon. So let's continue to do our part to not allow COVID-19 an opportunity to increase anymore. We know that we can do this. We know that these small and large sacrifices that we're making every day are making a difference, and that will save lives. We need to use our collective effort and momentum to keep going now through these next few weeks as more and more vaccines are available. And we need to remember every day that we're getting closer to a time where this pandemic will no longer be controlling our lives, and that we will be able to control this virus. I also want to mention that our Speak survey is still open for another week, and to date about 178,000 people have completed this survey. If you haven't done so, though, please take a few minutes to do that this week. In particular, if you live in some of the more rural or remote areas of the province, if you're a male, if you're over 75, and people from BC's many different ethnic groups, we encourage you to have your voice, to add your voice to this survey so we know how the pandemic and the measures that we've taken have affected you and your communities. And the survey is available on the BC CDC website under COVID-19 survey. Thank you very much, and remember that we will get through this period together. We're making a difference now, and we need to hold that line and remember to continue to be kind and to be calm and to be safe. Thank you.